Hello, welcome everyone. You're listening to the Health Insurance 411, and my name is Steve Stump. I'm really happy to be back. The beginning of the year has been a pretty amazing start for me, and I've got some really exciting things coming up on the horizon. Today, I wanted to talk about a recent article that I found. And before I get into it, if you haven't already given this channel a like or subscribe, or share this out with others, please do so because I really enjoy helping others learn more about health insurance and asking some of those key questions that so many of us have on a regular basis. Today, though, I thought I would review a really interesting article that I came across. It talked about the things you need to know when you start to Google your own healthcare issues and needs. Now, this has become extremely prevalent, especially in today's times where we are quarantined for such a period of time given the pandemic. And you have nothing but time on your hands and access to the internet. And so what people do is they start to Google their health concerns, and maybe it's a prolonged cough or a fever, and they want to diagnose themselves and their symptoms. Or it could be something more like the onset of cancer and the symptoms that might be showing is ugly head, and starting to Google those symptoms and lead you down a rabbit hole of what the condition is that you might have. Essentially, you're beginning to self-diagnose with the assistance of Google and the internet. But this article did a really fascinating job of covering the things that we need to know when we begin to Google about our own healthcare concerns. They broke it down into three big things that you need to understand. And this has really become prevalent nowadays when everyone seems to have an opinion when it comes to healthcare and healthcare issues. The number one is they suggested that you understand the influence behind the article and the source. What they talk about is there's really three sources for information that's on the internet that you need to be aware of, and then a fourth one that you can rely on, and I'll share that one last. Government influence. Now, with the pandemic, there has been a lot of information shared by not just the US government, but governments around the world helping their citizens understand the ramifications of the pandemic and how they need to address it. And each country handles it somewhat differently. And each country wants to influence its citizens in a different way. And with the internet nowadays, of course, we can get information from anywhere around the world. So the number one thing the article said is understand the government influence from the information that you are reading, and is that going to be completely accurate and meet your needs. The other one is, of course, industry influence. Now, this just doesn't have to do with the pandemic. Now, industry is in the business to make money, and you can actually, see a number of advertisements, TV commercials, and whatnot that'll say, "Hey, go to this website for this prescription and learn more." Right? Well, each one of those pharmaceutical companies obviously want to show their drugs in the best light in addressing the broadest range of symptoms so that more people want the drug and want to get prescribed it. And then the last one was personal influence. So this was interesting. And with social media nowadays, so many people want, to go viral and have a bunch of likes and a bunch of shares of their content. And so when your friends are sharing medical advice, healthcare advice, what is their personal motivation in doing so? And is that in line with really what you need from the advice that you're getting? Thought it was really, really interesting. Basically, the article said, you know what? Not all content is created equal. And it's exactly right. The other key thing was that whatever you find on the internet, that addresses your healthcare concerns doesn't know you personally. It's meant to be broad, or it might be specific to one person's case, especially if it's a personal testimony or something that someone individually is sharing on social media. And I thought the article did a really nice job of saying, whatever you read doesn't know you personally. You and your doctor know you personally, and then ultimately, you need to be that informed healthcare consumer going to your doctor with your concerns and together coming up with the right diagnosis. Now, interestingly, it did say that doctors actually appreciate informed patients, patients who do research and have a point of view on what's going on in their bodies, and then partners with the doctors to help diagnose and prescribe whatever ailment they currently have. So I thought that was really, really good. Now, skepticism is something that you should keep alive and is healthy to have. I love this quote. Blind belief in authority is the greatest enemy of truth. I'll read that again. Blind belief in authority is the greatest enemy of truth. And on the internet nowadays, we can believe that something that we are reading is of authority, when in reality, it may not be based in any authority and any real logic. So, found it very, very interesting. The title of the article is "How to Improve Your Google Searches for Health Information," and the last thing it said was, "Know that we don't know it all." Is a really interesting analogy. So, back in 2006, before 2006, Pluto was still a planet, and then in 2006, our scientific knowledge progressed thus far to be able to say that nah, Pluto's really not a planet. And so keep in mind that the information and the research you do on the internet is only up to date as of the point at which you do the research, and give it time, months, years down the road, and that research can change. Of course, with the pandemic, with so many things changing so quickly, it does seem that you really need to be on top of all the information on a regular basis. Now, lastly, it did share some really reliable sources that probably will come up in your Google searches, but we may not think that these are the sources that are going to be the most interesting to read, and we're probably going to gloss over them, but you really should not discount these sources. The Mayo Clinic is a really good source, as well as the Cleveland Clinic, and then Johns Hopkins Medicine. These research institutes and hospitals provide information on a plethora of healthcare issues. And if you are at these institutes and centers sites, then you know you're getting reliable information. Keep in mind, it still doesn't pertain to you and doesn't know you personally, but it's much better than your friend on Facebook sharing their healthcare advice. And the other one was the Journal of American Medical Association. You can actually go to Up to Date and actually Google, or I'm sorry, search content in these journals. And of course, that is the publication where doctors publicly publish their findings. So I thought it was a really interesting article. I thought I would share it. In today's days, we all want to try to self-diagnose ourselves and then be an informed consumer. But doing it for healthcare can be tricky, and navigating the internet can be difficult to really know what's true and what not. So I'm going to post the link in the comments, and definitely take a minute to read the article. But I hope you found this video helpful. One of the things I love doing is helping people understand that healthcare and health insurance is rigged against them, but you can change the game in your favor. I've got a video that explains it and explains why the US government has been backed and propped up the healthcare and the health insurance industry. And now why you have options to not participate in that marketplace and in that industry because it's simply not in your favor to do so. So if you haven't checked out the video, do so. My name is Steve Stump. And lastly, if you have not given this a like or a share, please do so. Stay tuned for tomorrow. We'll be providing more helpful information on the Health Insurance 411. Thanks. Have a great day.